UCSD Basement. My name is Gabriel Fisher. I'm the CEO of a UCSD-based startup called Embrace HealthWear. And our business is meant to save lives. We're literally creating small biosensor wearables that attach to the center of mass of people that have balance problems, such as the aging, the frail, injured, or disabled. And what the sensor does is it translates how these fall-prone individuals move into digital waveforms, which then gets sent up to the cloud, where we do machine learning to analyze, sort, filter, and classify their motions. And ultimately, we use all this information about how they move to predict and prevent falling injuries. So falls are the leading cause of fatal and non-fatal injuries in older adults, costing more than $31 billion in medical expenses. And if you go to a retirement community or hospital and you talk to the caregivers, such as physical therapists or doctors, there's a lack of tools necessary to track the recovery of their patients and to understand how they're moving outside of the doctor's office or outside of the physical therapist's office. So this is all untapped data that we think is very useful. So the vision is we have Embrace, and it goes into this healthcare system, helping the physicians, the physical therapists, the elderly, and their family to understand how their fall-prone patients or family members move. And what we can do is we can predict falls 3 weeks out with 85% accuracy, and then intervene either through calling them, sending them emails, and give them professional recommendations, exercise recommendations, lifestyle habits that will improve their balance and reduce the risk of having a falling injury. There's current competitors, personal emergency response systems such as Life Alert, but this type of product is only helpful after the person has had a life-threatening injury. And so what we want to do is predict and prevent before the life-threatening injury occurs. And that's what makes our solution so special. So we're targeting older adults in retirement communities, their family members. We're hoping to distribute through hospitals, the senior care facilities, and possibly even license out the technology to hospital systems and insurance companies who are actively working in the dynamic risk of people. That's something that's going to be a huge field in the next 10 years, is calculating risk based off certain features of people's mobility.
Currently, we're using off-the-shelf motion sensors to collect data and train our machine learning algorithm, and at the same time, we're working towards developing our own patentable design in hardware and software for the motion sensors, and we project that in the next 6 months, we'll have a fully manufacturable product. We've already taken steps to reach out to local San Diego warehouse assemblers to print our PCB, so things are in the right direction. In addition, we also have in schedule a collaboration of clinical testing with Dr. Rose from Fullerton State Center for Healthy Aging. And in there, we hope to collect over 200 patients' data in terms of their motion information.